Okay, hello everybody. Welcome to another episode of What's Next After BDS. Today I have with me Dr.VAISHNAVI Prabhakar, a colleague whom I met recently, and she's going to discuss about OFP, probably a new specialty in as a part of dentistry. So, ma'am, can you please give a short intro about yourself?
I am Dr. Vaishnavi Prabhakar. I met Dr. Vinay in one of the courses that we had joined together. Very nice meeting you, Vinay. And I am a prosthodontist, and I took up orofacial pain and completed my master's and then a diplomate of the ABOP and practicing in Chennai. That's about it. That's all I have done. And I'm currently doing my PhD in temporomandibular joint disorders.
Oh, that's nice to know, ma'am. Okay, ma'am. So my first question would be, before that, I would also like to tell people that I am also currently doing the fellowship in OFP. And after doing, or probably I'm still a part of the program, so I could see a lot of me approaching the case or the patient in an entirely different way. But since ma'am has finished the diplomate, she would be able to explain in a better way. So ma'am, so why OFP first? So how did you, what made you feel like you should join this course in the first place?
See, I was very fascinated with temporomandibular joint disorder as a postgraduate by itself. So it is a very interesting field for me. So when I took up orofacial pain as a fellowship course, it was basically an approach to learn more about temporomandibular joint disorders. Then as it went on, I realized there is more to pain in the face rather than just temporomandibular joint disorders and dental pain. So then the whole, slowly the whole part of the orofacial pain started sinking in, and now I'm completely enjoying it.
Okay. So can you briefly tell us about the course you finished, ma'am? The orofacial pain course.
So I've done the orofacial pain course from with Dr. Thomas in Smile USA. It is a very comprehensive program on the clinical aspects of facial pain and understanding how to each and every step and how to examine the patient and the history taking. It is not easy to diagnose a patient with an orofacial pain syndrome or a symptom or a clinical feature because it requires a lot of steps and a lot of grilling and a lot of training for us to understand the subject basically and then to diagnose a patient. So every patient who walks in, we initially before the course, either it was a psychological patient or it was a temporomandibular joint disorder pain or a dental pain. Now we get after the course, you get to know a lot of things about other pain syndromes that is happening in the face.
Okay. So it
is a very clinically approach useful and a comprehensive program.
So it actually changes the way you even see the patient, right, ma'am? So
approach, yes, it completely changes. Yes, correct.
Okay, and how can you justify, not exactly justify, how can you elaborate about the clinical importance of OFP now? Suppose a person coming from a dental background versus a person coming from an OFP background, right? So when he approaches a patient, so how exactly will it alter his approach to the patient?
See, when you're a general dentist and when you approach a patient with pain, we are very narrow in our process of thinking. We tend to think everything is related to occlusion, and we tend to think everything is related to the dental issue that is picking up the pain. So when it comes to an OFP practitioner, you will broaden the view, and when a patient with pain walks in, you will also give importance to the underlying musculature, the gums, the nerves, and the surrounding structures, and even the central nervous system